Well, Kathy, there's a phrase that I think you'll recognise we try not to use in journalism, which is only time will tell. But it's very hard not to talk about that now because there are so many unknowns, trying to explain why the cases of COVID are currently falling. Average daily cases are down 15%, and the last time they fell for 6 consecutive days was in February, and it isn't what was expected. We had the Health Secretary himself warning that they could reach 100,000 a day by autumn. Instead, they're going in the other direction, at least for now. So some of the explanations are schools have now broken up, and we know this was where high case numbers could be found. There could have been the effect of the Euros too, and yes, the vaccines are likely to have had an effect along with warmer weather. But many experts are warning that this is too soon to declare the third wave is on the run. For a start, it looks like daily testing is down by quite a lot. So perhaps it's just people not going to be tested. In England, the rules were only relaxed last Monday, and it will take a while for those numbers there to filter through just because of that time lag between infections and being tested. And then we will be looking in the next couple of weeks for what is happening in hospitals and with people dying, because that is always at least 2 weeks behind. And then we'll be looking for what's happening with that time lag as it happens. So it's not the clearest of explanation, and it has actually taken some people, or many of the experts, actually by surprise.
Victoria, thanks very much. Well, joining me now is the government's former chief scientific advisor, Professor Sir Mark Walport. Professor, is there an easy explanation for this significant decline in cases, in your view?
No, there isn't. I think Victoria's just given you a very good analysis, actually. It's clearly encouraging that the numbers have fallen so much over such a short time, but it is definitely too early to declare victory. And there are just a lot of moving parts. So a decline in testing may be important. The good weather, people spending more time outdoors, is good news. It really is too early to see the effects of the changes that happened on the 19th of July. And I think it's absolutely right. The sort of most robust measure, in a way, is the number of people who are getting admitted to hospital. And that lags about a week behind a case being identified. So those are the numbers that are rather rigorous, and they're not so affected by the numbers of people being tested and things like that, because if you're ill enough to go into hospital, then you probably will. The key thing is, sorry,
I was just going to say, would you be
vaccinated?
Yeah, I'll come on to the vaccinations in a minute, but would you be optimistic that we may have reached the peak of this third wave, or are you sort of braced for an uptick in a week's time when the full effects of that reopening phase in?
Well, the short answer is I don't know the answer. I think that that's one of the challenges at the moment, that predicting the future is very difficult when there are so many changes happening at once. Clearly, the high numbers of people vaccinated is good news, as it were, but there are still 70% of the adult population that have only had one dose, although the number of second doses, those numbers are staying high. But it really does matter that younger people who are eligible for the vaccine get it, because, given a choice of having a vaccine or the infection, it's a pretty easy choice, actually.
Right, so would you actually quite like to see vaccine passports to get into sporting events, or even for students to attend lectures in the autumn?
Well, I mean, it does provide an incentive, and the evidence is still what happened in the Netherlands when they had their very steep spike was they did see evidence of transmission in places like nightclubs, and also in some external events where people were in tents that may not have had sides but had a lot of covering. And so, if you're going to be in a crowded, poorly ventilated, potentially noisy space, then you're much safer if you've had a vaccine. So it's good for you and it's good for others as well.
You're not worried about the kind of discriminatory aspect of that, or the kind of, the state control reaching far into people's lives?
Well, I mean, do we have, this is a sort of libertarian versus utilitarian question, and it's ultimately a political question. It's not one for scientific advisors to decide. But, this is an issue not only about protecting yourself, but about protecting others. And so, you may have the right, as it were, to expose yourself to a risk, but do you have the right to expose others to a risk?
Just coming back to the numbers, would you be prepared to say, credit where it's due, that the government's gamble, which was called the English experiment elsewhere in the world, to reopen and just press on despite these very high daily case numbers, that gamble might have paid off?
Well, I hope so, is the answer. And there clearly was an argument for now being a good time to do it, in that schools are out, and that does reduce social contacts and transmission. And, you know, the incentive to spend time outside is much higher when the weather is nice. And whilst there are other respiratory viruses circulating, not at the same sort of level as is likely to happen in winter. So, you know, all things being equal, if you're going to open up, now is the right time of year to do it. But I don't think the government were expecting to open up when we were heading towards 50,000 cases a day. So, you know, the short answer is, I hope so.
Professor Sir Mark Walport, thanks very much for joining us. John.